Imagine as you're walking, talking, living your life.
You can only breathe through a straw.
And sometimes the straw is stuffed with cotton. You try to get more air in, but the cotton in the straw won't let you get a deep breath.
More Americans than ever before have asthma, and there is no cure.
Asthma is one of the top reasons for missing school.
Kids with asthma, like me, can feel isolated and afraid.
Y'all ready?
But we don't need to sit on the sidelines.
Let's see what you got now. Hit it hard as you can.
Most kids can play sports like football if our asthma is managed, but we need your help.
1, 2, 3, tackle asthma!
Did you ever think you'd be playing the harmonica?
No, land sakes alive, no.
For years, breathing has been difficult for Glenda Green.
What was your first thought when you first signed up for this class?
Ain't no way. My first thought was, I said, I can't hardly breathe, much less how am I going to play a harmonica?
Jim and Glenda have chronic obstructive pulmonary disease, known as COPD. By learning how to play this tiny instrument, patients have noticed a big difference in their overall quality of life.
I can take deeper breaths, I can hold my breath longer. It's definitely made an improvement on my breathing.
When we started this program, I asked how many people are practicing their harmonica daily, and everybody held up their hand. And I'm just giggling because I'm thinking, no, what you're doing daily is pulmonary rehab.
At first, organizers were hoping maybe 5 people would show up. Instead, 25 walked through the door ready to learn.
It definitely helps, and it is enjoyable. Just being with other people, that helps out a whole lot, just getting out of the house a lot too.
I've been so excited to watch them in this transformation and just to know their stories and a little bit of their history and the struggles that they've been through, and to see the hope and the joy and the excitement that they have every week when they come together.
Bian Araha is a graduate student at San Diego State University. She and 3 other students are huddled around the back of their car, checking their gear. Students are at the Massachusetts Avenue trolley stop in Lemon Grove. Their equipment will allow them to measure things like noise and pollution. Grad student Brittany Akins points to 2 tools that measure pollution that might be coming from a car or truck.
Well, these 2 both measure particulate matter. This one just measures the bigger one, so it takes the mass.
Students, working with their professors, are sketching a sort of data map of Lemon Grove. That map will help them shape the city's climate action plan.
Here's Lemon Grove Avenue. Here's the 94 to orient you guys.
Miranda Evans and City Manager Mike James are giving a class of graduate students a briefing on their bedroom community of nearly 26,000 residents. James says the city is still feeling the fiscal crunch of the Great Recession, and that makes the student contribution so vital.
Each student that's participating with us is able to help the city because we only have 52 employees.
Universities have excess capacity, and so we have tons of students who want their work to be meaningful. They want to be doing real-world projects. They want to be doing things that they know can make a difference.
Professors and city officials guide the different aspects of the general plan project. Students do the legwork.
So to actually be doing something in a city that matters and that doesn't have this kind of information is very rewarding.
Eric Anderson, KPBS News.
I'm Kathleen Mead. I'm the president and CEO of the San Diego Foundation, and we are absolutely delighted that you are with us here today. This is our first event in La Mesa, and judging by the turnout, it seems like we got to come here more often. Thanks for being with us. So the San Diego Foundation and our Center for Civic Engagement is about bringing community together and sharing with you information that is available in our community through studies and reports and information that oftentimes go unread and unheard about because in our busy days, we fail to understand that these are even available to us. We don't know how to reach this information. Well, you're going to learn more about how to get to this information today. Now, I hope you enjoyed your lunch and the video. Thank you, Peggy, for arranging that video for us. You know, that video is really special because it helps us to understand how communities like San Diego State can involve their students in the community. So let's encourage our universities and our schools to help those students get engaged in their communities. Now, it's easy to think about or not think about what we don't see. You know, the bacteria and the viruses in the air actually affect us, and personally and our families. And when we look around and see blue skies, we don't see smog like we sometimes see in Los Angeles on a hot day, or on movies or programs on the television. We look outside and we say, wow, San Diego is absolutely beautiful. But it's those things that are in the air that we don't see that make us sick, that make it difficult for us to perform our daily functions, whether that is at work or at school or with our families. And we're going to talk about that today. In a moment, you'll learn more about the declining air quality in San Diego and what you can do to ensure that you are helping to make a difference in our cities. You know, recently, the city of San Diego adopted its climate action plan, and in March, La Mesa specifically adopted its plan. So congratulations to you and La Mesa.
My name is Hannah Green. I'm the Director of Policy at the Center for Sustainable Energy. We are headquartered in San Diego, but we work across California, the Northwest and the Northeast, to accelerate the adoption of clean energy and transportation technologies, which directly links not only to our carbon emissions, but to our community health and to our air quality. We'll touch on some of that more today. See if the clicker likes me. So as I said, I'm the Director of Policy at the Center for Sustainable Energy, but today I'll be focusing on one particular project of ours. It's the Equinox Project. The Equinox Project is an initiative of CSE here in our headquarters, our home, San Diego County. It was formed in 2008 to be a map of our region, to provide us data and indicators so we understand how we're performing against sustainability metrics for environmental and economic indicators. Our vision is for current and future generations of San Diegans to live in a region that is a shining beacon for sustainability. We create engaging research by tracking key environmental and economic indicators. We produce data-backed environmental and economic research. We communicate these findings to policy practitioners, decision makers, and elected officials. And we engage with young adults to participate in regional, environmental, and economic issues and support a growing civic engagement in our communities. Our goal is to inspire, inform, and engage the public and decision makers to craft better solutions to our regional problems. We push for informed decisions backed by real-world data. So what are some of our regional challenges, and how are we understanding them? When we talk about regional challenges, we might all feel these as individuals who live in our communities, in our professional lives with the issues that many of you here touched today: civic engagement, housing, public health, sustainability, climate, affordability, equity. We touch all of these issues that roll up to make a true sustainable community, environmentally and economically. The Quality of Life dashboard tracks 15 different metrics of sustainability, and together they provide us a picture of how we are performing across San Diego County. We recently updated the Quality of Life dashboard and the 15 issue areas that you see here, and I'll be sharing a link with more information so you can dig into the data and the resources we have online following today's event. We track these issues year over year and have done so since 2008, so we can see trend lines. How are we performing year over year? Where are we getting worse? Where are there problem spots and bright areas that we can shine a light on and learn from? Air quality is one of the issues that we've been tracking, and in recent years we've seen a decline in air quality across San Diego County, and that's of course what we're focusing on here today. It's a bad trend line. The combined number of unhealthy air days and unhealthy air days for sensitive groups increased from 42 days in 2016 to 62 days in 2017. 42 days to 62 days in 1 year. That's a 48% increase. The number of unhealthy air days for sensitive groups, that is our community members with lung disease, the elderly, and children, increased 16 days in 2017. Overall unhealthy air days for all of us increased by 4 days. The region still has 0 extreme unhealthy air days, but we can see a troubling trend line here. I want to note, looking at the past metrics, that we actually saw an improvement in air quality through our measurement and the data that we collect from our partners from 2008 to 2010. But since then, and particularly in recent years, we've seen significant declines in air quality and an uptick of what we'd consider true unhealthy air days. This map shows asthma hospitalization rates for children and can be an indicator of poor air quality. It is varied throughout the county, as you can see, but some of our highest rates for asthma incidents in children are in downtown San Diego, Barrio Logan, Logan Heights, El Cajon, and surrounding areas, including our border communities. These communities also represent our highest impacted environmental justice communities and communities of concern. The American Lung Association's 2017 State of the Air report gave San Diego County an F for ozone pollution and a D for short-term particle pollution. This is a fact that our team brought to my attention that grabbed me and that I'm going to leave here today with, and hope you do as well. But San Diego was ranked the 7th dirtiest city in the country for ozone pollution. We have one of the most beautiful coastlines in the world. We can walk outside and see blue sky and clean air and beautiful palm trees, we don't always recognize what's in our air. So that one really stuck with me. 7th worst in the country for ozone pollution. Why is this important? Air quality is important to our public health. And according to a report by California Breathing, some 400,000 San Diegans have lung disease, such as asthma and chronic obstructive pulmonary disease, COPD, like we saw in the video to kick us off today. These residents, our neighbors, our colleagues, our friends, our family, are at a heightened risk from air pollution. This means we have more people in our hospitals, more people suffering, more people unable to enjoy outdoors and athletics, and at its most extreme, shortened life expectancy. What are our causes? We have so many experts in the audience here today that I'm most looking forward to engaging with you all in a discussion of the data and information and research that you see and experience and that you find, and that I hope we can highlight and talk about today. So I'll touch briefly on a few areas that we know to be causes from our research, but I'm also looking to many of you to learn a great deal today, not just on causes, but on solutions and paths forward. So we know in San Diego, in the broader region and the county as a whole, that the majority of our air pollutants come from vehicle emissions. These vehicle emissions include nitrogen oxides, a precursor to smog, metals, acids, benzene, and formaldehyde. Why are we seeing increased vehicle emissions and an increase in unhealthy air days related to them? We could talk about congestion, more single driver vehicles on the road, longer commute times. We could also look at other factors such as increased heat, climate impacts, and weather impacts. So there are multiple different areas that we can look at, and I look forward to discussing with you all today. Solutions. At the Center for Sustainable Energy, we do focus on energy and transportation, and we work hard to promote, support, and accelerate the adoption of electric vehicles, electrified public transit, and renewable fuels, not just for transportation, but for our homes, renewable energy, batteries, et cetera. So we do see a path there to reduce our emissions and transition to a clean energy future. I know many of you will have solutions to bring to the table today as well, and I look forward to learning that from you all. So with that, I want to thank our sponsors listed here, as well as our partners who support the research and the data that we share in the Quality of Life dashboard. I encourage you all to use the dashboard and to give us your feedback. The dashboard is a community resource that helps us understand our performance as a region. It's a wonderful place for us to highlight case studies and to share your data, and we really hope to continue to tell this story, track our metrics, and find pathways to improve as a region. Thank you all so much for hosting us today, and please do feel free to follow up with me, and thank you for the conversation.
We have a very special guest here today to talk about the health risk and the impact of unhealthy air days, and that's Dr. Atul Malhotra. He is the past president of the American Thoracic Society, chief of pulmonology and critical care and sleep medicine at UC San Diego Health. And welcome, Dr. Malhotra.
Well, thanks very much, and thank you to the organizers for having me. It's quite a distinguished panel, so it's my honor to be sharing the podium. Let me start with a show of hands, if I may. How many of you think that maybe 25% of people in the room will be affected by air pollution? How many people think 50%? How many people think 75%? How many people think 100%? So this may be a biased audience, but but I'm going to argue it does affect 100% of us in different ways, either directly or indirectly. And I'm going to start with a disclaimer, and that is I'm not going to talk about global warming. And the reason for that is that it's not my expertise. I'm a doctor. I take care of patients with pulmonary critical care and sleep disorders. So I know a decent amount about the health effects of air pollution. I don't know a lot about global warming. And my contention is that political debate over global warming has obscured the major cardiopulmonary toxicity of air pollution, because people will debate that and politicians will go on about that forever on either side, and to me it's hard to resolve that. I'm not an expert, and I haven't talked to many people who really know a lot about that topic, so I'm going to put that aside. But I talked to a lot of people from different sides of the political spectrum who say that, well, you know, I'm all for economic growth and we need to build and the economy needs to grow, and I agree with that. But what I'm going to argue is I don't want the economy to grow at the expense of my kids' lungs or your kids' lungs or your kids' lungs, because that's really not the right approach. And so I'm all for economic growth and prosperity and all that. We can have both, right? We can have a booming economy and we can have clean air. I don't think that's one or the other. So I'll say it one more time just to emphasize that. I think political debate over global warming has obscured the major cardiopulmonary toxicity of air pollution. I'll do another show of hands. How many of you think that if you're exposed to air pollution as a baby or as a child, that could affect how big your lungs are as an adult? Yeah, so that's true, and that's been shown. There was a paper in the New England Journal of Medicine a few years ago that I'll talk about. How many people think it could affect your brain function? Again, it's a biased audience, but you're right. It has been shown to affect neurocognitive performance in terms of how the brain works. I do a lot of research in sleep apnea as well. How many people think it could affect your sleep apnea? Okay, by the nature of the question that I'm asking, you're right. It can affect sleep apnea and make that worse as well. How many people think there may be an association with Alzheimer's? Yes, that's true as well. So there has been an association there. The other point I'd like to emphasize just at the top here is what was a point that was already made. It's the point that what you can't see is what kills you. So some people will go to developing countries and they say, boy, you couldn't see the pollution was so thick you couldn't see the next building and all that. And the visible air pollution is not good, but it's the stuff you can't see that kills you. So even though San Diego is beautiful, as we've already heard, the ozone and the very small particulates that are invisible are the ones that are damaging our lungs and other things. It's true that asthma and chronic obstructive pulmonary disease and these things are made worse by ozone and by air pollution, that's for sure. The emergency rooms in Chicago, they get overrun with kids having asthma flares when the ozone levels are high. It's not a sort of chance association. It's not debated either. It's not like there's politicians out there saying, yeah, ozone's good for you. There's no discussion about that. The study from Los Angeles that was published in the New England Journal of Medicine a couple years ago, to me, was quite striking, because over some periods of time there's been improvements in air pollution in Los Angeles. And so they looked at 3 different time periods between 1990 and 2010 and looked at 3 or 4 different counties within Los Angeles. And as the air pollution got better, the growth of kids' lungs improved. So they measure something called the vital capacity, which is how big the lungs are. Those things got better as the air pollution improved. And that means everybody in the room that has kids or grew up here or whatever, the size of your lungs and how big your lungs are could be affected by what you breathe in. It's not that surprising, but it was quite striking to see it in writing. They also looked at neurocognitive performance, that is how well your brain is doing, how your brain performance. That was also impacted by air pollution and improved with improvements in air pollution. I'd like to talk just for a second about a global impact as well. As you heard, I was president of the American Thoracic Society, which is a large professional organization that's global. We're in 110 countries, I think, around the world, and we help the world breathe is our motto. I'd like to talk to you about a study that was published in the Lancet Global Health a couple of years ago. And this was looking at people in Uganda, in Africa. So they did spirometry, that is a breathing function test on people in Uganda, just at random. They didn't select for people with lung disease or anything else. And they looked at men and women in Uganda in the rural areas. And about 15% of men, about 17% of women had evidence of chronic obstructive pulmonary disease. I'll say it again, 15% of men, 17% of women had evidence of chronic obstructive pulmonary disease. So you say, okay, maybe that's for a reason. Well, it turns out of the women, more than 90% had never smoked cigarettes. And yet 17% of the women in Uganda in rural Uganda, had evidence of chronic obstructive pulmonary disease. What's more shocking is that the life expectancy there is not very good. So if you look at the women with COPD, that is emphysema or chronic bronchitis, 40% of them were in their 30s. Between ages 30 and 39, a lot of them had COPD. And so why is that striking? Well, when we solve other problems like basic hygiene and communicable diseases and other things, the air pollution problems around the world are going to get even worse. I was born in Canada, but my roots are India. If you go to India, of the 5 most polluted cities in the world, 4 of them are in India. You go there, you can't see the next building, and again, it's what you can't see that's killing you. There's a meter in New Delhi, India, that I drive past when I go to my uncle's house, and it's permanently hazardous. People just ignore it because the air quality is permanently there hazardous. It's quite shocking. But you might say that's not my problem. That's in Uganda, that's in India. San Diego is, as you heard, 7th worst in the country. I'd actually heard 6th worst, but anyways, we're in the top 10 list we don't want to be on. There's also this thing about COPD, chronic obstructive pulmonary disease, where people blame the victims. They say, it's your fault, you smoked, right? Well, for the women in Uganda, they're being exposed to cook stoves and outdoor and indoor air pollution. You can't blame the victims. I have plenty of patients with COPD here that had either secondhand smoke, or maybe they smoked 30 years ago and that was part of the problem. Maybe they're exposed to a lot of air pollution as a kid and we just don't recognize that or can't capture that effectively enough. So there are plenty of reasons not to blame the victims. Even if somebody smoked 30 years ago, what was known about cigarette toxicity, what was happening to subsidies to tobacco and stuff at the time, again, it's hard to blame the victims. Some people are rigorous scientists. I'm actually one of them. I like doing carefully controlled experiments. And people say, well, where is the carefully controlled experiment that shows air pollution is a problem? Well, nobody's going to do a randomized trial of exposing people to air pollution or no air pollution. It's never going to happen. We talk about in research, we talk about a mother trial. That is, I'd put my mother into a trial where, you compare 2 different things. There's another type of research that's called a mother-in-law trial, and that's very different. There's one other study in the New England Journal of Medicine that was published a year or 2 ago where they looked at Medicare beneficiaries across the country. I believe it was about 60 million people that were getting Medicare in the United States that were in this study, and they looked at air pollution patterns. And sure enough, it did have an impact on mortality. So there is life and death sort of expectations here, and that's why it's important. You might ask, what can I do? Well, they'll say, ride a bike and take a bus. Those things can be helpful. But doing more than that is also helpful. So advocacy is helpful. In my capacity at the American Thoracic Society, I went to Capitol Hill a lot. And we talked to politicians there. They come from different backgrounds. But inevitably, the conversation goes to CO2 and global warming. And I say, I don't want to talk about that. It's not my expertise. But I'll tell you about my kids' lungs. And that's not okay. It's not okay to grow the economy at the expense of my kids' lungs. So advocacy can be important. Writing to your politicians can be important. And raising awareness can be important, and that's why I'm here, because hopefully that message has come across. So my take-home messages for today are that air pollution affects everybody. Whether you're a child or an adult, it has an impact, and there's no debate about it. There's nobody in medicine or in politics that's saying ozone's good for you or small particulates are good for you. There's no debate about this. The problem is a global one, but the problem is right here in San Diego as well, and so we can't ignore it. And as I say, the first step is raising awareness, and so I'm delighted to see you all here. I thank you all for your attention.
thank you so much. It's really a pleasure to see you all and be here in La Mesa to talk about a lot of these really important issues. And I'm especially happy to have followed Hannah and also Dr. Malhotra for the very reason that I am not an air quality specialist. But one thing that I have focused on a lot in my work is climate change and action on climate change. And while there are some important differences, there's a lot that is also related. And I think while you've heard, there's definitely some cause through the data to pause and really look at what the data is showing us about our air quality. Absolutely, we have to recognize that our air quality in San Diego has significantly improved in the decades since the 70s and 80s, and that is thanks to the collective efforts of many in this region, in this audience and beyond. And as Peggy mentioned, it was really, looking at that uptick of recent data that we really wanted to shed a light on and connect to some of these other regional issues that affect our quality of life here in San Diego. I love that the dashboard looks not only at air quality, but as Hannah mentioned, some of these other interrelated issues, alternative transportation, electric vehicles, how much energy we use, how much we sit in traffic, how much renewable and clean energy we're starting to use, and also climate action. And that's one connect that I wanted to just also pause on and connect the dots on for the topics today. At the San Diego Foundation, we have spent, the better part of a decade now looking at how we can catalyze greater regional action on the issue of climate change. And while experts in the room, I'm sure, can talk a lot more about this, there are important differences between the air pollution from fuels that are burned locally and how that exacerbates local risks from air quality, and also the greenhouse gas emissions that we burn and rise into the atmosphere and affect us globally and also over the long term. There are a lot of things that we can do to address both, and I think that's where the synergy really needs to lie. That includes, reducing how much we drive by investing in other alternatives, in convenient alternatives like transit, biking, walking, carpools, all of these bike share. With proper looking at how they can affect the quality of life of communities. Also, all the efforts that have been going on over the past few decades to improve fuel efficiency of cars, promoting more electric and hybrid vehicles, cleaning up the sources of our local power, like many residents are doing in the number one solar city in the country, in San Diego, really looking at how we can adopt more solar and other types of renewable energy in our region. And also ensuring that as a region we protect these spectacular natural resources that make our region so special, and also the trees and green space within our urban communities that can also do a lot to improve our quality of life and community well-being. There's also a lot at stake if we don't address these two issues in a concerted way. I was reflecting on how we started out at this issue of climate change at the San Diego Foundation, and it was right in the wake of the 2003 and the 2007 wildfires. And there's a lot of interrelated issues in terms of wildfires, our air quality, and climate change. And we can think about these issues together. We know that with the impacts of climate change, we're likely to see warmer temperatures, longer dry seasons, and that our wildfire seasons may be longer and more extreme, which puts us at risk for more frequent or more intense wildfires. Californians throughout the state saw these impacts, not only the direct devastation that wildfires caused just this last fall, but also the indirect dangerous air quality conditions that brought to the broader communities adjacent. And interestingly, wildfires can also be a large source of greenhouse gas emissions. So there's this feedback loop. The data showed that in 2003, the wildfires in San Diego were the single largest source of greenhouse gas emissions that caused climate change that year. So there's really a lot in terms of the causes and also how these issues are going to play out in our region that we have the opportunity to think about in a coordinated way. And I think the really good news is that there's a lot that we can and we are doing by working together and investing today. And at least through the San Diego Foundation, one of the metrics that we've been looking at is how many cities are making commitments to reduce climate change and to also better prepare their communities for the likely impacts of climate change. When we launched our climate initiative, only 2 cities out of our region had any commitments to reduce emissions. And I'm really excited today that all but one of our region's 19 local governments are working on or have adopted a climate action plan. I think that's definitely worth celebrating. And as I think it was Kathleen mentioned, the city of La Mesa, where we are here today, just adopted theirs in March. And that has really important goals in there around reducing overall emissions and doing that by improving on the access to transit, which we have here in La Mesa, also improving how bikeable and walkable the city is already. I know the city was recognized in 2012 for being one of the most walkable cities in our region. So a lot of great progress to build on. And also committing, like a handful of other cities in the region have, to source energy from 100% clean renewable energy sources within the near future. So a lot to really be excited about. Throughout the county, we have, as I mentioned, a number of other cities that have either adopted or are working on climate plans. I think of Coronado working on one, El Cajon, Escondido, Imperial Beach, Oceanside, Santee, Vista, as well as Lemon Grove, you saw highlighted in the work with the SAGE project at SDSU. So I mention that because I know people are coming from many different parts of the county. And I would note, there is a really important connection to our work in this space as a region of innovation around our economic growth as well. And I think we've seen after poll that San Diegans really believe and value that we can have both a healthy environment and a strong economy at the same time, and they don't have to be at odds with each other. I know the city of San Diego, in their recent climate action report, just highlighted both their overall emissions had declined 19% over this time period that they were looking at, and GDP had grown 30% in that same time. So I think there's some really great opportunities that we can, if we do this, leveraging our best assets here in the region, we can do this and have multiple improvements for our quality of life. And I think, like many other sources out there that the Equinox dashboard pulls from, while there's a lot to be optimistic about, there's a lot more we need to do to make these metrics move in the other direction. And we also have a lot to do to actually put these plans in place, right? I mean, it's hard enough sometimes agreeing on the policy. It's a whole nother challenge to actually move forward on action. And that's why we need all of us. We need all of us together. And I think especially making sure that we're taking stock of the communities in San Diego that have long borne the poorest air quality as well. Communities such as Barrio Logan, or those situated in proximity to heavily trafficked areas, obviously the border region being one, or other communities that are directly affected from freeways, busy surface streets, other local industrial sources of air pollution. We really need to make sure too that those communities, that we do an intentional job of ensuring that they benefit from innovations and sustainability and climate action, and that we uplift those communities through this work rather than continuing to leave some of the same communities behind. So that is really where we are excited about moving the ball forward, working together with those of you in the room, with other partners and stakeholders, thinking about these issues, albeit there's some some important areas of difference. There's some really important areas that we can continue to work together to improve air quality and also climate change. So with that, I know I'm going to pass it back to Peggy, and we really want to hear a little bit more from you. So I'll leave it with a teaser, and she can explain.
All right, now it's time to get out your phones. This is where you come in. This is where you come in. We're making this go. First of all, you'll notice these cards on your table, right? You'll see what Kathleen had mentioned, the hashtag HealthyAirSD. You are welcome to tweet any questions, comments, ideas, anything like that. We will be, if you have questions, we'll be addressing them later on our social media or also on our website. If you don't like tweeting and you don't like phones, then you can also, we'll be posting a blog about this on our website, and you can go ahead and post your questions and comments there as well. So we'll be addressing those afterwards. Now, it's fun time. So the straws. You got your phones out. Go ahead and take one of these straws on your table if you haven't already. We're going to do what's called the Straw Breath Challenge. And this is experiential. So we're going to start out with experience. So I want to, if you have a medical or lung or heart condition, or you just get dizzy easily, you may just want to observe your table mates, because I promised the doctor here that we wouldn't make them work during lunch. It was one of our agreements. So if you feel like you're getting dizzy, don't do this. So go ahead and unwrap it. These are, again, recyclable compost things. I'm kind of interested in what they look like. Oh, they look like regular straws. All right. And what you're going to do is, and I'll just run through it real quickly, and then we can do it. You're going to take a slow, deep breath in and out just to clean out your lungs. And then we're going to breathe through this straw. So let's go ahead, take a slow, deep breath in. Oh, good. The air conditioning is helping us. And a slow, we're visualizing air here. And our slow, deep breath out. Now, pinch your nose. I want you to put your straw in your mouth, tighten around your lips, and I want you to take a deep, deep breath in, as much air as you can possibly breathe in through the straw, right? Keep breathing in. Keep breathing in. Then when your lungs are completely full, close your lips tighter and try to breathe out only through the straw, right? You can repeat that if you feel like it. See how that makes you feel. Of course, if you're dizzy, please stop. Our insurance doesn't cover that. No, all right. Okay, so that's the straw breath exercise. So you did it a couple of times. All right, it's all right. You're sitting down in a nice, comfortable room. Imagine going to work, walking to your car, picking up kids, walking your dog. It would get harder and harder. And that is just the beginning when you feel an asthma attack come on, when you feel your COPD acting up. That's the beginning of it. Of course, it gets much worse than that. If you've ever seen anybody who's had a full-blown asthma attack or somebody who can't breathe, it's terrifying. You know, you can imagine if you're at the bottom of a pool and you see how far you have to get up and you can't get there, what happens to your heart rate, what happens to the rest of your body. Okay, so that was the big, exciting straw exercise, and feel free to take some straws home and show others. All right, but what we really want to do is get you guys connected with each other and get some of your ideas, and as we mentioned, there's a lot of experts here, and sort of share and brainstorm about what we can do to make a bigger impact on quality of life and on air, not only in East County, La Mesa, Lemon Grove, but all over, wherever you're from.